Hello, my dear doctor. Welcome to the topic that is adult onset Still's disease. But the file that we call that is a knowledge-based application. We put a name that is a KBA. And this KBA word will be helpful. In that way, the word itself and says that the knowledge-based application. What does it really mean? It does really mean that the knowledges that we gathered from the video lectures, my dear, and how to apply all them together. To apply these knowledges, the best, the things that we can do from ourselves, so that we can give the right answers with confidence. So giving the right answers with the confidence, applying the knowledges that you gathered from the topic that you learned from the video lectures or maybe from here, and knowledge-based applications, KBA. I put this KBA in another form that the K for we can say that the question, B for best, A for approach. Means question-based approach is another way that we learn here, that how we will approach to the questions. What happened in your exams basically? You'll have the questions, my dear. You'll have the scenarios. So what we divided into the questions, let's talk. Let's have an examples right here. The question starts with an 18-year-old lady ... and then go down, and you'll see that the examination, own examination, you see, all right. And here is also, you see the own examination, and you start with an 18-year-old lady. And after that, you see some of the photography is also given here, and also photography, and also another photography. And after that, you see some of the investigations are also given, that we call the data. And lastly, that the question is given. You see what is the most probable diagnosis. And after that, you'll see the answer options. So if you divide into the questions that we'll face in our exams, my dear, so we can divide into the first part, that is the history telling, means the history, important bits and history, important parts of the history. And second part is the examination findings. And third part I call usually the investigations, means the data. And fourth part, maybe the photography. Not all questions will have the photography, but the photography will be there. And fifth part, the main questions, my dear. And last but not the least, the answer option, that is the sixth part. So what will be the best approach? Means the KBA, knowledge-based application, into the question-based approach. So my dear, listen very carefully. We have to, the first step, whenever you have a questions, like you see, you start with it here, and you read starting from here, then go down, then having some of the photography, and also after that the data as well, then the question, then answer options. So it's being a bit of tiring. Reading the old questions, coming down, and the answer options, thinking about the answers, it's really a tiring in exams. My dear, listen very carefully. So the best approach, always, whatever the scenarios sides, please start with the main first, or the first step. Read the main question. Main question means what is the most probable diagnosis. Sometimes what two tests that you will do something like that means the main question, the first step. What I'm saying, the first step is to read the main question. Main question means here, as for example, what is the most probable diagnosis, so that a candidate will have an idea. You will have an idea what things that you are dealing with. You can have an idea from this question that you are dealing with the diagnosis. So definitely the things are given in your scenarios, including your history, examinations, photography, as well as the data, investigation findings. All them are sufficient to reach your diagnosis. So you can understand. So the first step will give a lot when you start with this first step, my dear. Yes, you must do the first step to read the main question. And second step is the answer options, reading all them together. Yes, start with here. The answer options like here, AOSD, that is the adult onset Still's disease. Option B, systemic lupus erythematosus. Option C, lymphoma. Option D, infective endocarditis. And option E, brucellosis. Having an options A, B, C, D, E, this is the second step that you need to read very carefully. And the third step, that you have to think about important features of each and every answer options. Maybe some pathognomonic features, maybe some or single point that you learned from a video lectures, or that you learned from here, from this KBA as well. So you have to apply this knowledge here so that you can focus into the questions and scenarios. And after that you see the SLE and also the lymphoma and also the infective endocarditis and brucellosis. So you have to think at least the one, two important features of each and every diseases so that you can focus into the scenarios. Third step, my dear, after having reading these scenario answer options, is the second step, the third step, to read and go directly into the main scenarios. And scenarios, as I said, the scenarios having a part of history and also the examination, second part, and third part is the data and investigations, and fourth part is in photography. So among this fourth part, which part that you must read first once again? So immediately after the first is the main question, second part is the answering and reading the main answer options, and third step to think about each and every answer options, some of the important features. Fourth step, directly if you have the photography, please look at into the photography, because photography says a lot. Let's start with the photography. You see a photography here, there is a rash. At least we can understand a rash. Next ECG, a photography showed that ST elevation, you see V2, V3, as well as the V4, ST elevation, V5 and V6, but there is a concavity upwards. So ST elevation, concavity upwards might be the diagnosis of acute pericarditis. So we have an idea. Pericarditis means a part of serositis with some of the salmon pink rash. An X-ray is normal X-ray. Nothing is here. So serositis, salmon pink rash, diagnosis, Still disease. At least the two important features that we can get. So from down to up, top, that we need to think something. So yes, my dear, so whenever you have the first step, there is what is the most probable diagnosis, immediately after that, that you have the answer option A, B, C, D, E. You read them very well. And after that, whenever you have the adult onset still disease, please remember the SS box that you learned from the video lectures of adult onset still disease and each and every topics as well. So let's remember adult onset still disease here, the box that we learned here. Here's the SS box. You see AOSD, A for arthralgia, S for sudden pink rash, and S for spiking fever, quotidian with WBC count greater than 15 into 10 to the power 9 per liter. So the measure criteria. So what I'm saying, the fever, rash, arthralgia, having a triad, fever, rash, and arthralgia with the two minor criteria, and you put the mnemonics of the stills. As for serositis, pleuritis, pericarditis, and ECG and echo pictures may have sore throat and splenomegaly and hepatomegaly. So serositis, sore throat, splenomegaly, T4, to exclude the two important diseases like the rheumatoid factor and antinuclear antibody. And I for inflammatory markers like the increased, I for iritin or ferritin, all right. And L for LFT, up, arrow up. And L for lymphadenopathy, which is generalized or cervical, but this is reactive changes, the important differential diagnosis, the lymphoproliferative disorders. So adult onset still disease having a typical picture, so the multi-system involvement, a very good differential diagnosis that you see the two important diseases like rheumatoid factor as an antinuclear antibody, so rheumatoid arthritis as well as the SLE. And here is the lymphadenopathy whenever it comes up. So we need to exclude the lymphoma, at least. So what do we learn basically? The AOSD, the fever, rash, arthralgia, and having the SDI, double L, yes, as for serositis, at least T for to exclude, I for inflammatory markers, L for LFT, and L for lymphadenopathy. So with this learning process that we will focus into the scenarios. So I said the scenarios, the most important, the first step into the scenarios, that is the photography. Means the first step is the what is the most probable diagnosis. Second step is the reading the answer options. Third step, each and every options having some of the pathographic features, means the SS box that you learn, think about them, and then jump into the scenarios. And in the scenarios, the fourth step, that into the photography. And photography, we have seen the sudden pink rash having and serositis, means the pericarditis. So still this is the likely diagnosis than that of anything else. So my dear, we will confirm now more and more our diagnosis. Let's see. The fifth step, immediately after the photography, that will focus onto the data. You see the data is hemoglobin 9.8 and platelets 469. So hemoglobin low, alright, platelets high, because normal platelets is 150 or 200 to 400, so it's increased. MCV normal, malaria parasite absent, so malaria is excluded. ESR raised, CRP raised. So circle. Sodium, potassium, urea, creatinine, everything is normal. Blood cultures, 3 blood cultures are negative. Thyroxine and TSH level is normal. ECG shown above, chest X-ray shown above. And rheumatoid factor absolutely absent. So once again, rheumatoid artery is excluded. And urine analysis, trace of proteins, but no blood. So my dear, the things that I circle, and do circle with me and just follow me, my dear. So hemoglobin low with the normocytic normochromic anemia as well as the platelets normal increased, raised DSR, raised CRP, and also some of the trace of the proteins. These are nothing but inflammatory markers. So low hemoglobin, raised platelet, raised ESR and CRP as trace of the proteins are also due to the inflammations. So all of the inflammatory markers once again in favor of AOSD, and also the criteria that we learned, that two diseases that we are excluding, that is the rheumatoid factor is absolutely absent here. So once again confirming the adult onset stale disease. Next to the data means the fifth step, yes, that we have to focus on to the scenarios. But scenarios also have the history and also examination parts. But my dear, what I'm saying, the best approach is go down to up. Means examination first, then go for history. So let's talk on non-examination. She appeared unwell. She had a temperature of 39.2 degrees centigrade. So here's the fever. We got the fever. And widespread rash shown in. The heart rate is tachycardia and blood pressure is normal. Here is small non-tender palpable lymph nodes of the anterior cervical triangle. So once again, yes, the L for lymphadenopathy, we got it. So once again confirming the adult stale disease. On examination cardiovascular system, she had a very soft systolic murmur at the left lower sternal and a soft third heart sound. So this is due to the anemia, leads to tachycardia. But the chest was clear, so this is not a case of heart failure. Abdominal examination once again revealed a palpable spleen. Here's the splenomegaly. We learned it. She had a fuse shorty lymph nodes in the inguinal regions. Once again, generalized lymphadenopathy. Cervical spine movements were slightly limited due to the pain. Her hands were swollen and tender. Once again, the arthritis, fever, rash, arthralgia. The left shoulder was painful to abduct, but there was no obvious swelling of the joint. Examination of central nervous system as well as the fundoscopy were normal. So we confirmed having the patient the fever, once again having a rash, once again the patient having the arthritis, fever, rash, arthritis, and then go for, yes, the stales. So where we have got, we found the lymphadenopathy, we found the splenomegaly, and also sometimes we can get this hepatomegaly as well. So another confirmation on examination findings. This is also a case of adult onset stale disease. Next, the last step into the history, my dear. So an 18-year-old lady was admitted with a 7-week history of the malaise and joint pains. Here's the joint pains, arthralgia. We are focusing from down to up. She had pain affecting her neck. So once again, arthralgia, small jets of both hands, and she had intermittent fever associated with profuse sweating. She was born in Nigeria, traveled to London for further studies 1.5 years back. She had not traveled abroad since. She was well while in Nigeria, although she had 3 mild attacks of malaria. At the age of 3, 7, and 11 years, she was a non-smoker and teetotaler, means non-alcoholic. 2 days back, coming into the hospital, she developed some sharp inframammary chest pain, which was worsened by the movement, deep inspiration, and on lying flat. So sharp inframammary chest pain with the movement and deep inspiration, lying flat, are consistent with the pericarditis. There was no history of the cough or sputum production. Her appetite was slightly reduced, and she had lost 3 kg in weight. So, because the appetite is reduced, so some weight loss is inevident, alright? So what I'm saying, my dear, once again we have proved that the fever, rash, as well as the arthritis and arthralgia, and also having the serositis evidenced by the pericarditis. So more and more confirmation, there is a diagnosis adult onset steel disease. So my dear, what I'm saying, my dear, this is really important. The approach, right, once again, the knowledge-based application. The knowledge is that you have, you must know, apply them very, very well. If you have a knowledge, an enormous knowledge, feel it. If you have enormous knowledge, but you are unable to apply them into the terms, making your answers confidently, so what is the value of having this knowledge, my dear? So once again, having a good knowledge, applying them properly is the best way of knowledge-based applications that we call KBA, and question-based approach that we already learned it. So once again, summarizing, whenever you have the questions, my dear, in your exams, so start with the first is the question, mean the main question, first step. Second step, once again, answer options. Third step, thinking about the important features, means the SS boxes. SS boxes, what you learn from the lectures, video lectures, all together. And fourth step, focusing into the scenarios. Fourth step into the photography. And fifth step to the data. Sixth step into the examinations findings. And seventh step, that is the history findings. So focusing them and trying to confirm your diagnosis 7 times altogether. So these lucky 7 numbers and the steps will make you the luckiest person in the world, my dear. That will give you a boost up and much more confident you will give the answers very, very well. And you will feel that you will see subsequently applying these steps and these approach, you will feel much more confident, number one, and you will have less painful situations in the exam hall, because you feel now, if a candidate, what a usual candidate other than the SsAcademy, right, the people don't know this approach, right, what they do, they start with the question like, yes, an 18-year-old lady. I'm requesting you to the people, just forget the things that we learned, the 7 steps. If you do something like that and forget the scenarios as well, so what happened? So you will start an 18-year-old lady. You will think, all right, 18-year young lady, what the diseases, all right, let's start, then talk. Was admitted the 7-week, all right. You'll be very vigilant to focus on to the important data in your scenarios. Malaise and joint pains. So young ladies, 7 weeks, joint pains. You will think in that way. What will be the possibility? Maybe the SLE or something like that. She had pain affecting neck, left shoulder, small joints of both her hands. All right, let's see what next. She had intermittent fever associated with profuse sweating or fever, SLE, okay. She was born in Nigeria, traveled to London for further studies 1.5 years back. All right, born in Nigeria. So Nigeria, what disease? SLE. Traveled to London for further studies. She had not traveled abroad since. You will be confused, all right? The confusions will be more and more. Let's see. Feel it. She was well while in Nigeria, although she had had 3 mild attacks of malaria. You will focus here. All right, malaria is a possibility, maybe, all right. She was a non-smoker and teetotaler, okay. 2 days before coming into the hospital, she developed some sharp inframammary chest pain, which was worsened by the movement, deep inspiration, and lying flat. All right, maybe you can think, all right, this is a pericarditis. Yes, this is SLE, no doubt. There was no history, cough, sputum production, appetite was slightly reduced, lost 3 kg. Once again, you can think, all right, okay, SLE can cause. On examination, she appeared unwell. She had a temperature 39.2. Okay, SLE can cause fever, rash, heart rate. SLE can cause lymph node. Okay, On examination, cardiovascular system, soft systolic murmur, okay, confusing in your mind. Abdominal examination revealed a palpable spleen once again. Yes, SLE can cause limb nerves once again, cervical spine cannot move, hands are swollen, tender, confusing. Alright, central nervous system, fundoscopy, normal. Alright, SLE. Alright, done, SLE. Alright, because you don't have enough time. Here you see the hemoglobin once again, platelet, MCV, malaria, parasite, ESR, CRP. Maybe you stuck here. Alright, in SLE the CRP should be normal, ESR should be raised, but you learned that pleuritis and pericarditis can cause the CRP can be raised. Alright, SLE is the diagnosis. Rheumatoid factor negative, once again SLE is a possibility. Alright, yes. So what is the most probable diagnosis? You will put the SLE diagnosis with much more confident, or maybe with lots of confusions, my dear. Maybe you suddenly thought, alright, this is maybe a Ehlers steel disease because of the rash is typically someone pink or something like that. But even then you'll have lots of confusions in your mind, then go through, that will be confusing for the next questions, next scenarios. And further confusions, sometimes I do fun. Confusions leading to convulsions, leading to coma and death. Alright, my dear, so this is ridiculous. So what I'm saying that the KBA, once again, the knowledge-based application, my dear, listen and just try to follow these KBA files. And also the KBA means K for Q, okay, fine, the question-based approach, the 7 steps that we learn from here, and try to follow them very well, and that will be the best learning as well as the best approach as well as the best pass, my dear, from the side you said that you can do. I think you enjoyed the knowledge-based application as well as the question-based approach. Thank you very much. If you like our videos, don't forget to subscribe our channel and click on bell button to get more updates.